welcome to today's talk on male urinary tract infections, a topic that's often overlooked, but it's actually relatively common. In this video, we'll be discussing what a UTI is, how it affects men, what you can do to prevent infections, and how you treat them. So if you're a man or you know someone who is, this video is worth watching. First of all, what is a urinary tract infection? In most cases, a UTI is caused by bacteria getting into your urinary tract. The most common bacteria is E. coli, and that's the main cause of UTIs in around 90% of cases. Your urinary tract system is made up of different parts which can all get infected, and these parts include your urethra, which is the tube that takes pee out of your body, your bladder, which stores your urine until it leaves your body, your ureters, which are the two thin tubes that take urine from your kidneys to your bladder, and lastly your kidneys. These are small organs at the back of your body above your hips that make your urine. The most common forms of a UTI happen in your lower urinary tract, and these include cystitis, which is when your bladder is infected, and urethritis, when your ureters are infected. An upper urinary tract infection is when bacteria has infected your kidneys or your ureters. The medical name for a kidney infection is pyelonephritis. So why are UTIs more common in men than we think? Well, there are several reasons. Men have a prostate gland. The prostate gland is an important part of the reproductive system in a man, and it helps produce a milky fluid that helps make up your semen. The fluid from this gland may contribute to bacteria growing in your urinary tract and leading to infections. Another reason is men can have structural problems, especially as they age. They might get an enlarged prostate, and this can further increase the risk of urinary tract infections. Now let's talk about symptoms of urinary tract infections in men. Symptoms can include a burning sensation when you pee, using the toilet more often, needing to pee urgently, cloudy or blood in your urine, and pain in your lower abdomen or back, pressure over your bladder, and in some cases fevers or chills. If you experience any of these symptoms and you're a man, you need to see a doctor, as this infection can lead to serious complications if you leave it untreated. These complications can include kidney infections or in some cases sepsis. Risk factors for getting urine infections in men include BPH, benign prostatic hypertrophy. This is when your prostate gland gets enlarged and wraps around the neck of the bladder. This makes urine flow slow and therefore puts you at risk of bacteria accumulating. Other factors include using a catheter, previous urinary tract surgery, and a weakened immune system. How are urine infections in men diagnosed? A diagnosis in a man usually involves an examination and sending that urine sample off to the lab for something called a urine culture. This is when we grow your urine in a lab and we see what bugs are inside to make sure we give you the right antibiotic treatment. Your doctor will be able to rule out other conditions which can have similar symptoms. These conditions include an inflamed prostate, epididymitis, and in rarer cases, bladder or renal cancer. Here are my doctor's tips for when you see a doctor. When you go to see a doctor, take a sample of urine with you. If you don't have a urine pot at home, you can use another sterile and clean container. Before you use the container, remember to wash it with soap and at least 10 times with water. Allow it to air dry. This usually means that there's no bugs in the container, so when we send your urine sample to the lab, it means that we have an accurate sample. The second tip is that you need a midstream urine. This means not the urine at the start of when you're peeing or at the end of when you start peeing. It usually involves starting to pee, collecting your sample, putting the sample away, and finishing peeing in the pot. This is because we need the midstream to make sure we are accurately diagnosing you. And my third tip, remember to wash your pee hole before you collect your urine sample. And this is again to make sure we don't catch any of the bugs in the area around your urethra. We want to catch the bugs in your urine. Self-care and home remedies you can use to prevent a UTI include good toilet hygiene, always wipe from front to back. Number 2, pee as soon as you have the urge. Don't hold on to your urine longer than necessary. This helps your bladder flush out any bugs in the bladder. And remember, when you're peeing, fully empty your bladder, again to prevent bacteria gathering up. Pee as soon as possible after sex, again to flush away any bugs which are lingering in the area. Staying well hydrated is very important. Drinking the recommended level of fluid helps flush out any bugs, and remember to avoid sugary food or sugary drinks, as this can encourage bacteria to grow in your urinary tract. Avoid harsh soaps, douches or sprays in your genital area. Stick to plain water for this sensitive area. Treatment. Treating a male UTI usually involves a course of antibiotics which can kill the bacteria that are causing the infection. The specific type and duration of antibiotic you need will vary on lots of factors such as which bacteria are involved, your personal health and any resistance you have, and how severe the infection is. Tips on treatment include making sure you take the full course of antibiotics even if you start to feel better. This is to prevent resistance building up to antibiotics. My second tip is to make sure you take any necessary pain relief you need. This is to help with your symptoms such as pain and fever. My third tip is to drink plenty of fluids to flush out any bacteria even when you're on treatment. If you're a man and you're given antibiotics, usually the course is around 7 to 14 days. But remember that your doctor will give you specific advice, and these are prescription-only antibiotics. When do you need to speak to a doctor? Most people start getting better within around 48 hours. If you're not getting better and it's been 48 hours, speak to your doctor and get urgent medical advice. It's also important to get urgent medical advice if you've finished your antibiotics and your symptoms are returning, you're getting a high fever, you're feeling confused, the pain is getting worse, or you're noticing blood in your urine. These symptoms could mean you have a kidney infection or another more serious infections, and your doctor can help support you. So what's the difference between a UTI and a bladder infection? Cystitis is when your bladder is infected, and a UTI stands for urinary tract infection and refers to anywhere on your urinary tract. With a UTI, you won't usually be able to tell exactly where the infection is in your urinary tract because the symptoms are similar. But don't worry, they're diagnosed and treated in similar ways, so it doesn't usually matter. Is it possible to treat a UTI at home without the use of antibiotics? Most UTIs in men will need antibiotics. Delaying treatments could lead to complications such as kidney infections or sepsis, and that's why you need to speak to a doctor urgently. So what's the difference in men and women with urinary tract infections? Well, your body has two main exits where waste products come out, and that's your pee hole and your poo hole. These two exits are closer together in women, so it's easier for bacteria to move from your bottom towards your urethra. As women have a shorter urethra in men, that's why they're more likely to get infections. In summary, a UTI is a real issue and shouldn't be ignored. By knowing the symptoms, taking steps to prevent infections, and treating them in the right way, you can stay healthy and avoid serious complications. So here are my 5 top tips for urinary tract infections in men. If you're a man with new symptoms, get diagnosed early. Number 2, finish the course of antibiotics even if you start feeling better. Number 3, follow the self-care tips like pain relief and keeping yourself well hydrated. Number 4, see a doctor if your symptoms are not improving, you are feeling worse, or they have returned after you finish the antibiotics. Number 5, make sure you follow preventative measures such as keeping your area clean and peeing when you have the urge. Thank you for watching today's video on urinary tract infections, and I hope it was informative.